Well, in the image that is in front of you, you are seeing, and I am showing you the left kidney that measures approximately 10.1 centimeters in length, and the length it's normal lengthwise. Now, its parenchymal thickness is 15 millimeters at the upper pole, is 10.4 millimeters at the anterior mid-region, and 15.8 millimeters at the lower pole. Now this is the upper pole, this is the lower pole. Now these black areas you are seeing are the dilated calyces, and this area, this one, this tube-like structure entering into the inner pelvic region and then communicating with the dilated calyces is the proximal ureter. The proximal ureter measures approximately 11.8 millimeters. Now more than 7 is considered to be dilated proximal ureter. I did get a question about a video regarding minimal hydronephrosis and minimal dilation of the proximal ureter. But a question was asked, is dilated ureters or proximal ureters seen always in calculi? Well, here today is the day for the answer of that for the gentleman who asked this question. That no, not every dilated proximal ureter or the hydronephrosis or dilation of the calyces is due to a calculus. Now otherwise, if we see that the kidney is normal, so the corticomedullary distinction is intact, the upper capsule is normal. So it was important to give a little bit of this information to you. Now this is an ultrasound that we are going to perform of an 65 years old male. So let's start it now. This is the kidney, and you are seeing the dilation of all the calyces, and in right lateral posture I do see dilated ureter, but this dilated ureter, this one is the dilated ureter, is compressed in this region, in the right number region, by a solid mass that can be a lymph node as well. Anyhow, I will not like to comment. This is a solid hypoechoic mass that is well demarcated, and this is pressing on the proximal ureter and is the cause of the hydronephrosis that you are seeing. Now I say the kidney is normal. You see that this is the medulla and this is the cortex, so corticomedullary distinction is intact. Now there is a large mass that extends from the left lumbar region, presses the proximal ureter in this region. This is the proximal ureter, this is the ureter, and this is the mass. Now this is not a lymph node. Had it been a lymph node, it would have not been communicating with the other part. This is a large solid mass in front of you. Now when I come to the left upper abdominal quadrant, I see this mass, and you see that this mass is complex. It has internal cystic. These are cystic areas, as well as islands of echogenic material. This is one of them. This is the second one, and there are calcifications within it. This is a calcification within this mass, and it's a loculated sort of a mass, well loculated mass, and here you see the aorta is coursing posterior to it in this region. first of all see the configuration of the mass, the appearance of the mass. It is very, very remarkable. It is complex. It is loculated as well. While loculated, you will see a thick band separating the cystic area, the lower part and the upper portion. Now you see that the upper part is well demarcated. This is the outer boundary of its wall is approximately 14 millimeters. The wall of this complex cystic and solid mass. Now we do see a little bit of posterior wall acoustic enhancement through this mass, and it is because of the fluid components within this complex mass. Now you see, these are two fluid components. Number one, this is the other one, being separated by a thick linear echogenic area. Now this is the fluid compartment. We see the posterior wall acoustic enhancement. This is the solid, inhomogeneous solid area within this lower compartment of this mass, and here we don't see any posterior wall acoustic enhancement. Now you will see that now I am moving downward, and you will see that the aorta courses posterior to this solid mass. This is the mass. This is the aorta with patient in left lateral decubitus posture. Let me show you the patient lying in left lateral decubitus posture, and this section I am getting in this region with aorta coursing posterior to the mass, and it measures in this region approximately 15.4 by 12.7, or I will say 16 by 13 centimeters, very large mass, and this is the aorta coursing posterior to it. This is it. Now here you will see that this mass is giving this is the spleen, this is the spleen, this is the left hemidiaphragm, no pleural effusion seen. Here we see the kidney with dilated calyces, with hydronephrosis, dilation of the proximal ureter, and from here onwards we see a complex mass with cystic and solid components within it, as well as calcifications. And it can be traced up to the left lower abdominal quadrant. So this is the mass which I am in this is the urinary bladder. The urinary bladder is unremarkable. This is the prostate. I can show. Patient is tender. This area, this is the urinary bladder, this is the prostatic fossa with normal prostate, and here we see the mass as I move upwards, extending from the lower. This is the urinary bladder, this is the urinary bladder, it extends and expands from the lower abdominal quadrant upwards up to the right lumbar region, where you can see it's giving the mass effect on the ureter, because of which the kidney is showing hydronephrosis. The dimension of the kidneys are normal, and this is a section of the mass. Now, does this mass relate to the kidney or not? It is a very difficult question to answer in this case, because though the impression is that this upper pole is clear, it does not relate to the upper pole mid region, and this is the lower pole of the left kidney. This is the lower pole of the left kidney, the hydronephrosis, and it appears that the mass is a bit apart from this kidney, but and here you can see that it is quite apart from the kidney. So it is not a renal mass, thus one thing is sure, though you cannot be 100% sure, but seems to be not relating to the left kidney. Now the mass expands, as we can be seen, crossing the midline. Here we are, it crosses. Now here, this is the mass. Here I am at the umbilical region, and on the right side of the umbilical region I can see the mass. So it crosses the midline, and there is a small extension of this mass into the toward the right side. This is an extension of the mass crossing the midline at the level of L4, L5 umbilical region. Now this is the mass, the larger one, crosses the midline from here and then extends towards the right side. Now its extension measures approximately 7.3 into 4.2 centimeters. And this extension is a bit echogenic, more echogenic than the outer surface of the outer margin of the mass. It's more echogenic and well demarcated. So this is the pancreas. This is the pancreas, splenic vein. It does not relate to the pancreas. Here we see the superior mesenteric artery arising from the aorta. This is the aorta, this is the mesenteric artery. We don't see any lymph nodes in this region. This is the liver. This is the right kidney, and you see that the right kidney is normal. The right kidney is normal. There are few calculi seen in the gallbladder. This is the gallbladder. So this portal vein, is patent normal. This is the IVC. Now the IVC appears patent, is not dilated. On the right side, now see that this mass is very, very demarcated. There is no significant posterior wall acoustic enhancement to call it as a cyst. However, there is abundant echogenic material seen with the anterior wall attached in this view, with fluid layered out with the posterior wall of this well-demarcated complex mass. So this is a cystic and solid mass. I will say that this is a left retroperitoneal mass extending from the left lumbar region up to the left lower abdominal quadrant, with the extension towards the right side, not involving the urinary bladder, no pressure effect on the urinary bladder, with aorta and the iliac vessels coursing posterior to it. And this is the part extending towards the right side. So this is a large mass, retroperitoneal in location, extending from the left lumbar region, then expands into the left upper abdominal quadrant, and then throughout its length in the midline, we can see this mass extending up to the left lower abdominal quadrant. It crosses the midline and it has an extension towards the right side. This is the midline region, this is the umbilical region, this is the extension, which is showing you that the extension is continuous with the mass here, and it is echogenic, more echogenic, well demarcated with internal central cystic area. These are the bowels. These are all bowels. So this is it does not relate to the urinary bladder. Mass effect is seen on the left ureter, which is seen giving us the picture of hydronephrosis of that of the left kidney, which is otherwise normal. No lymph nodes are seen adjacent to this mass. No paraortic lymph nodes are seen. No extension into the liver. No pleural effusion was seen, and no ascites is seen. So this is a case study, a retroperitoneal mass. Thank you.